confirming surgical and dental appointments. This is Wendy Myers with Communication Solutions for Veterinarians in Denver, Colorado, and we help practice teams improve compliance, client service, and communication skills. We have monthly CE credit webinars, and you can get more information on our website at csvets.com. We're also one of the largest phone skills training providers in the veterinary profession. You can get information about my new book, 101 Communication Skills for Veterinary Teams, and new DVD, Become a Client Communication Star, on our website. So in today's video tip, what I'm going to cover is ways to make it a much more pleasant and stress-free check-in experience for surgery and dentistries, and have it be pleasant not only for clients, but also for your veterinary team. I'm going to also walk you through a script to confirm surgical and dental procedures, and I'm going to put some key phrases in red that you may want to make sure you're using as talking points in your client conversations. You know, in the morning at a veterinary hospital, oftentimes it can be complete chaos, and that is because that we have 5 or 6 clients all arriving at the same time to admit their pets for surgery or dentistry. And a lot of clients, before 8 o'clock in the morning are already in a morning routine rush. They're trying to take children to school or get to work themselves. And then there's the competition and distraction of ringing phones at the front desk, and it can be a pretty chaotic environment. But unfortunately, sometimes we tend to do this to ourselves. And I'm going to tell you that when I look at the language that we use with our clients, it's no wonder that we have morning chaos. So I want to encourage your team to avoid the term drop-off, because by definition, the term drop-off actually means dump at the desk, hand you the dog's leash, and go to work. This really, with the term drop-off, implies that the surgical or dental admission process takes seconds. And my concern is that if there's 5 or 6 people now waiting to check in for surgery, and the front desk is trying to greet each person, those that are maybe a little more impatient and in a hurry to get to work might just check on the consent form, no, 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 sign it and leave. And this is what I call is decline and sign. And that's really bad for patient care. It's also bad for business. So what I want you to do is, in order to set expectations, is call clients one day before their pet's procedure to really confirm the amount of time to allow for check-in, and also to remind them of fasting instructions. So let's walk through our script, and I'm going to talk about the key words I've put in red. So here in the first paragraph, you'll see that you're going to remind them of fasting instructions for their pet's procedure, and you would have this just reflect whatever your hospital's protocol is. Then I want you to use the term your surgical admission or your dental admission is at 7:30 or whatever time you've designated. Now, some hospitals may have a window that patients are admitted between 7 and 8 a.m. I do prefer that you have set admission times and that you stagger them. That way you don't end up with a line at the front counter. So your surgical admission is at 7:30 a.m. with a technician. I do prefer that technicians, not receptionists, check in clients for surgery, because the technicians are more skilled to answer any medical questions the client may have. Plus, the receptionists are trying to already multitask with other ringing phones and distractions. So I like to have the technicians actually admit in an exam room. You're going to explain for the client to allow 15 minutes, because we will need to review the consent form, answer your questions, and get phone numbers where we can reach you the day of the procedure. Because it's so important that I have them allow enough time, I'm going to use the broken record technique and say it a second time. Please allow at least 15 minutes for your pet's admission to the hospital. Now, when you take a proactive approach and you call clients the day before and set expectations and delete the word drop off from your vocabulary and from any of your hospital forms, you're going to have much clearer expectations for your clients. And when clients arrive on time for their pets' admissions to the hospital, it also means that you're able to start procedures on time. So I hope you found our tip helpful today on how to prepare clients for surgery and dentistry with great confirmation calls. You can get more information on our training programs at csvets.com.